Thanks to an ever increasing dialogue within the media, menopause is a topic that is being spoken about a lot more these days. However, there still remains this kind of social stigma and a reluctance to discuss its impact and then to seek help for the symptoms that many may experience. So we have created these videos for you to watch to give an overview of the key things that you might want to know and then hopefully clear up some of the many misconceptions which exist. You might find it useful to watch these videos prior to coming to any specialist appointment that you might have, just to ensure you get the most out of that appointment. In this first video, we're going to have a look at why menopause happens and what symptoms you may be experiencing and why they happen. So menopause is commonly described as the stopping of your periods and is defined as 12 months from your last bleed. What this means in actual fact is that it can only really be confirmed retrospectively once you've been through it. And the most common cause is natural menopause, but it can also be induced by a surgery to remove your ovaries or certain treatments and medications such as chemotherapy and radiotherapy, which damage the ovaries and may also cause a premature or an early menopause. Most women tend to actually seek help in what we refer to as the perimenopausal period, that time leading up to your final period. We'll discuss in more detail in a minute the impact of the hormone estrogen, but large studies have indicated that a drop in the level of the hormone starts to happen around about 2 years prior to menopause happening. However, in actual fact, many women start to experience symptoms for a far longer period of time before that final period. In the UK, we quote the average age of menopause as 51. However, it's considered within normal ranges to go through menopause at the age of 45, and some may be in their mid-50s before their periods stop. The age at which menopause actually happens can be dependent on many other things, including lifestyle factors such as diet and smoking, whether you've had children or not, and your ethnicity. So we consider those whose periods stop before the age of 45 to have gone through an early menopause. So between 40 and 45, that's an early menopause. And for those who stop their periods before the age of 40, we refer to this as premature ovarian insufficiency, or POI. And this can have its own very real consequences to your health if it's left untreated. So it's really important that it is investigated fully by a specialist doctor. So let's have a think about why menopause actually happens. The ovaries are where the majority of the hormone estrogen is produced, and we have a limited number of eggs that we're born with. And when our ovaries stop being able to produce these eggs, they stop producing the estrogen. So that may be very suddenly following a medical intervention or over a gradual period of time. When that process is unable to happen anymore, the estrogen levels in our blood will drop. And so we initially start to see changes in our menstrual cycle when this drop happens, with more frequent or maybe less frequent periods, sometimes heavier, prolonged bleeding, and in others lighter and shorter periods. So if we look at hormones, they're kind of like a key which unlock various functions within our body. And when estrogen levels, which is our hormone, drop, they affect how the different organs throughout our bodies, including our brain, our skin, our bones, our muscle, and our heart function. And everyone will experience menopause a little bit differently, with the most common symptom being hot flushes and night sweats, which we may be very familiar with, but some may not have this symptom at all. Other frequently experienced symptoms include brain fog or memory issues, difficulties in finding words, for example. Mood changes, including anxiety, low mood, irritability and anger are really, really common. Sleep is often disturbed, and it may be worse if you experience the symptoms of hot flushes that wake you up at night. And then with that lack of sleep, it further exacerbates many of the other symptoms. Some may experience heart palpitations or joint aches and pains. And vaginal dryness and lack of libido is another very common symptom. We'll talk a lot more about these symptoms in more detail in another video, so do have a look at that if you're interested. Another thing I'm often asked about is checking hormone levels and whether it is helpful. So throughout the month and during the perimenopause particularly, hormone levels can fluctuate significantly from day to day and from month to month, meaning that symptoms can be more significant at different times. The hormone produced in our brain, follicular stimulating hormone, or FSH, is the hormone that we tend to measure if we are checking for menopause. It's what signals to the ovaries to produce estrogen. So with a decline in estrogen from the ovaries, our brains go into an overdrive, producing more of the FSH hormone. This level can also fluctuate, being normal at times during perimenopause, which is why it's not that helpful in ruling out menopause. In women below the age of 45, however, and certainly in those below 40, we will often measure this level to identify if it's raised when periods have stopped or significant symptoms of menopause are experienced. In those over 45, however, because menopause is normal within this age group, it's far more reliable to go on symptoms alone. And so therefore, levels are not measured because they may well be normal. We'll talk about measuring other hormones in our other videos. So ultimately, the symptoms of perimenopause and menopause often come at a time in our life when we may be caring for children or elderly relatives, have pressures within our jobs or families, and can lead to significant issues around how we're able to function in a way that we had previously and our confidence levels. It can feel upsetting, frustrating, and even embarrassing to be going through this transition, with some feeling a significant loss of identity or as though they'll be judged for talking about it. It's important to remember that menopause is a normal transition for every woman, but that absolutely does not mean you need to suffer in silence, as many have done for far, far too long. Understanding your symptoms can be a great first step to empowering yourself with medical and alternative therapies available, and that help can be absolutely life-changing.